Hello everyone. This is your host Rohan Tandale from InnoHealth Magazine Studio. I welcome you to this podcast produced by InnovatioCuris with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to the Voices of InnoHealth podcast from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite various industry leaders and discuss their views on the healthcare industry and innovations. Today, we are going to have a conversation with Dr. Jagtar Singh. Welcome, Dr. Jagtar, to our podcast. How are you today, sir?
I'm fine, Ron. Thank you very much. I think, as excited as you are to be on this, platform. Thank you very much for inviting.
Before starting, I would like you to tell us a little bit about your career path, your journey up to this point.
Okay, well, it's a long journey, right? And it will take me a little time to tell me about, tell about this, path that I took when I joined AFMC, that's the Armed Forces Medical College, way back in 1976. And then it has been always the OG, as they call it, the olive green, and that I have seen. And it has been a journey of 38 years, nearly, if I discount the years in the Armed Forces Medical College, in the Army Medical Corps. That's the Armed Forces Medical Services. After my superannuation, that is, after I had done my stint in the army, I worked in the corporate world for some time, right? And after having seen what the corporate healthcare is, I also learned a lot from, the various hospitals and healthcare institutions. I am presently now working as a healthcare consultant with a global healthcare group, and also, working as a guest faculty at a lot of other institutions where I enjoy talking to the students of healthcare management, healthcare administration, and other disciplines of healthcare, and especially talking to them about healthcare innovations and healthcare entrepreneurship. So that's been the journey till now.
That's a great journey, sir. Now, further talking about career, people utilize various resources available to them, of which some of them have a deeper impact on our minds. So, I would like you to share some of the resources or books that you found enriching in general or focused on healthcare.
Since I am from the stream of healthcare administration, I would say the biggest kind of a learning was when I joined the program of MD Hospital Administration at Armed Forces Medical College. So it is a structured program, which is of a 3-year duration, which gives us a very good foundation as far as healthcare administration is concerned in all its aspects, right? So including healthcare planning, designing, you know, marketing, financial management, and strategic management in healthcare, management of clinical services. So everything, you get a very rounded, sort of an insight into healthcare administration. So this has been the greatest influence on my decision to go into healthcare, administration, or I would say medical administration, which was a turning point as far as my life was concerned. And it opened up my, eyes to what all is required in the hospitals to make them work to deliver the best quality care that we can give to our patients. So this has been the biggest sort of, I would say, the influence. My instructors there, who are, well-known figures in healthcare administration, including Dr. V.K. Singh. We uh, admire him and we respect him as a, as one of the pioneers in healthcare administration. So that has been the influence. As far as if you ask me, uh, what are the books or other resources that, one would, remember offhand. I would say one of the books that has influenced me quite a bit, and I have read it, is Simon Sinek's Start with Why. That describes, anything that you want to do, you must have the passion for it. Discover why you want to do it. Very, very important. And then there is another book called Play to Win. That's another great book to read for anybody, who is venturing out into healthcare management. Very recently, I have, read two other books when I have been exploring this arena, I would say, of healthcare entrepreneurship and healthcare innovation. There is a book by John Carreyrou. He was an investigative reporter for Wall Street Journal. He's written a book called Bad Blood, and it is about the lies of the lies and the problems that startups have in Silicon Valley, written about 2015. But it's a very great book to read of what can go wrong when you are, starting off on a journey in healthcare innovation and healthcare, I would say, entrepreneurship. Another book, very, very well written, and I think anybody who is venturing into this field should read, is Zero to One by Peter Thiel. Now, Peter Thiel, if most of you would know, is the co-founder of PayPal and also of Palantir, which is a data analytic company. It's a great book, which it is based on his course that he used to take in Stanford University on healthcare entrepreneurship and healthcare innovation. And one of his students, Blake Masters, took very detailed notes of his classes. And then, in fact, he teamed up with this, student of his, Blake Masters, and wrote this book for a wider audience. So that's offhand, which what I can think of, talking about as far as the influence is concerned.
Those are some great resources. You covered most of the region from being entrepreneurial to being focused on the industry too. So I guess it would be a lot more beneficial to the audience. So now moving ahead, talking about career and experience, we all get our inspiration, the drive to perform from some source through our careers. So my question to you is, what inspires you in your work? Any individuals you idolize and why?
Uh, I think it would be really unfair if I start, naming individuals, right? Because there have been such great personalities one has come across in your life while you were studying, while you were working in the army, while in various parts of the country, in various capacities, in various responsibilities. So one had a lot to learn from each and every one of them. But I think the most important thing for any one of us who is in healthcare management and administration or involved in healthcare, we should have that open kind of a mind to always be a learner and pick up, what is good, and what is good not for ourselves but good for the patient. That should be your focus. You should always be trying to look out for things which can make you deliver a better medical care, a better health care for your patients, or for whoever is coming in touch with you, or whomever you are, reaching out. So I think that is the most important thing, to be a learner and be on a lookout, and not have that know-it-all attitude, but have that attitude that yes, there is always something that I can learn to deliver better.
That's a great way to put it in words. Instead of just focusing on a personality of a person, you should rather more focus on the attribute that you want to uh, mirror from the particular personality. So
Right.
now moving ahead, talking about innovation, the definition of innovation may be same for everyone, but the meaning, the value, or say the inference of the word differs from person to person. So, my question to you is, what does healthcare innovation mean to you, sir?
Well, if you really ask me very, very simply, I would say healthcare innovation is anything which would make, you know, the delivery of healthcare better for patient. It can be a product, it can be a device, it can be a process, or it could be just a method that you have devised, but anything which makes it better for the patient, I would say, that is healthcare innovation. And our aim should be always that, we make it the healthcare available to the patient in a easier, faster, more comfortable, more acceptable manner to the recipient, so that he is satisfied and happy in receiving it. Ultimate, I think it is that.
I would agree upon that, sir. Innovation is just not bringing about new technology in the industry, but rather providing service to the patient in a better way.
Right. I would totally sort of support that.
So now moving to the next question, we observe trends, both positive and negative, through various industries in this duration of pandemic. So I'd like to know, how did the COVID pandemic change your perspective on healthcare, especially when it comes to the innovation part?
I would say the best part about the healthcare industry during the pandemic was that, even though I would say, oh, it was overwhelmed, but yes, it had that resilience, it had that, sort of inner strength, and it had that belief to, ride this time throughout this very, very difficult period and come out, I would say, on the top of it. So this is a great lesson for, for all of us, and a great learning for all of us that who are here in the healthcare, and who are also outside this industry, that there was that, I would say, the inherent strength of the industry, which sort of helped us to, deliver to the best of its ability for the patients and care for them, even in very, very difficult circumstances. So my perspective for the healthcare industry is that it has a lot of strengths on which it can bank upon, and it can work on to even do better. But yes, there are certain weaknesses, there are certain lacuna, which did become apparent as we went along during the pandemic. And the best part of it is, I think the healthcare has been very, very, I think, efficient and very, very, responsive in sort of, addressing these issues.
True, sir. At the initial phases of the pandemic, we faced a lot of resistance in adaptation, but through time and acceptance of the situation, people kind of went along with the innovation and the adaptation that were
Yeah,
putting through towards them.
very true.
So now going ahead, this past couple of years, due to the arising need, we were compelled to innovate and to adapt to the change due to pandemic, due to which we got to see many innovations coming forward in various industries. So my question to you is, among all the innovations we have observed in the past couple of years, would you like to highlight some of the innovations that you saw during those years that you find promising?
Uh, if you really ask me, s- before the pandemic, also, if your question is, sort of also directed towards that, I would go back to the time that I was in the army, in the armed forces, and even at that time, we would, that is much before the pandemic. We would always would want to, adopt the technology to make the delivery of medical care, better for our soldiers. So in that case, we always look at the aspect of military medicine, or as they call it, remote medicine, or you may call it environmental medicine, or as we definitely have a word for it, which is called combat medical care. Now, this is the medical care which is available to a soldier right at the time or at the place when he's posted on the uh, highest of the mountains, and the uh, furthest in the deserts, or in the deepest of the jungles. So how do we provide medical care to a soldier? A soldier can get ill, he can get injured anywhere, right? But how do we innovate, or how do we think of this combat medical care? So that has been a challenge for the armed forces, and we have even thought about how we can reach out this medical care to a soldier, even in these very very difficult terrain and different situations. So there are various ways in which it has been handled. How basic problem is always hemorrhage when there is an injury. So how do you deal with this? There have been various methodologies, various devices which have been adopted by the army. Then how do you operate on a soldier? How do you reach out blood to a soldier, to the surgical teams at this areas? That has been very innovatively handled. Then again, how do you evacuate a soldier from these places to the higher echelons of medical care? That has also been very sort of uh, uh, thought about, I would say, in an enterprising way. So this was I would say much before the pandemic. But coming to the pandemic times, some kind of innovations, the methods which were adopted by our healthcare person, they do stand out. One of these things, let's say if you first talk about diagnostics, I like this idea of this drive through diagnostic services, or the testing facilities which were introduced by certain uh, healthcare providers in the in the scenario. That's a very innovative way. Then another thing which really caught my attention was a small robo which had been or a very basic kind of a robo which had been designed to go around in the ward with a either a tablet or a computer, so that the physician could FaceTime with the patients and talk to them without sort of himself donning on the PPE and going into the ward. So that was a very innovative thing, and very, I think, done very efficiently, and I think very effectively as far as the medical care was concerned. And the third thing which really struck me was that when we were actually, there was a crunch for resources, how we were able to manage to provide to as many people as we can. And one of the things which straight away comes to my mind is how to share a ventilator amongst patients, how to share the oxygen supply among patients. Very novel devices were, sort of, I would say, innovated by healthcare providers on the run, on the job, to sort of see that, every patient gets whatever his is due. So this is my sort of a take on, healthcare innovation during this period.
Those are some great innovations that you brought up, sir. Now, further talking about innovations, I would want you to share your own work linked to healthcare innovations, sir.
Uh, Mostly, Ron, I would say my work, which I can look back, has been in the, the army and in the field of combat medical care. So, as I told you, our effort was always to introduce technology, which is, sort of which is rugged, which is light, which is portable, and easy for a soldier or a paramedical to operate. So one was always looking out for these kind of technologies, and we introduced this aspect of healthcare technology assessment in our system or in our medical organization, and we were able to pick out certain products or certain devices which we introduced, and one of them was a small laboratory uh, diagnostic kind of a equipment set, which was in just a suitcase, right? So, and it met all the criteria of being rugged, because you have to carry it to areas where air conditioning or temperature control and these kind of things may not be available. So it was rugged, it was light, it was portable, and it was easy to operate, and gave the reliable results as far as laboratory is concerned, or tests were concerned, because those laboratory tests have to be available to the surgical team when they are operating. Then we were able to introduce portable X-rays machines for our, so for our field medical care units. Then we also, one important thing which we looked at was the various platforms which were available to evacuate our soldiers. This is very, very important. Those evacuation, casualty evacuation, as I would call it, platforms are very, very important for us, because during this period, during the time of evacuation, we have to make sure that we are able to provide the life care to life, sort of saving care to the soldier during his evacuation period, which can be as long as sometimes 1 to 2 days or even more sometimes. So this is what has been the thrust as far as technology and its introduction.
Those are some great innovations, sir. Contributing or say innovating in such situations takes a lot of effort, and the healthcare industry as well as all the civilians are thankful to you and the team for the military for that, sir.
Thank you.
So now going ahead, we observed great advancements in the healthcare industry through the years in India, but there is always room for improvement. So what is the one thing that you wish we could change in Indian healthcare in future?
Well, if you really ask me offhand, the one thing which comes to my mind is something which we need to all work on, and it's not an easy, I think, an aspect of the healthcare. That is accessibility. Now, accessibility in healthcare is so very important. That person who is, even when he is healthy, he should have that confidence that when he falls ill or when he needs it in an acute situation or in an emergency, that healthcare will be available to him, right? In the manner that which he requires, nothing more, nothing less. So, and equitable or healthcare, accessible healthcare, I think is a challenge which which is there for the healthcare industry. It has been always there. It's not that it has emerged something right now, and it will not be there in the future. But this is something that we would always need to keep thinking, keep working on, and keep doing something about it, because that is what is important, and that is where it lends us the credibility and the respect in the society, on the community that we are supposed to be serving or are destined to serve.
True, sir, I agree with your point. Up until now, we would say that healthcare industry was more focused on the tier one cities only. So now it's going to the lower tiers too. So I guess that accepting, adapting to the
It needs to reach out. It
Yeah,
needs
sir.
to, I would say, I don't know whether I should use the word step up or step down, but it has to see beyond, the metros, beyond hospitals, beyond the uh, sort of established institutions. We need to find ways where we can reach out in as many vital ways, and that is where the aspects like telehealth or remote medicine, all these come in. You know, so
Exactly, sir.
these we have to make it accessible. You
This
know,
kind of telemedicine and all makes it scalable to a wider demographic.
yeah,
So I guess that adaptation of that kind of technology would far more be beneficial for the industry as well.
very true, very true.
So for my final question, I would like to ask, where can our listeners connect with you, sir?
The listeners can connect with me. Most welcome to send me an email. That is one. It can be shared by email with them. There's no problem on that. I'm also on LinkedIn, so that they can, talk to me through that. Unfortunately, we are not there on Facebook, because somehow it's a carry forward from the army days where we were not permitted to be on these social media. So, but these two definitely. Otherwise, my phone number can be shared. Anybody who would like to get in touch with me in any aspect or any opinion, advice, or anything they want, or they want to share, it most welcome.
The link to connect with our guest speaker, Dr. Jagtar Singh, will be down in the description. Before concluding, I would like to thank Dr. Jagtar Singh for joining us and sharing your perspective. It was a pleasure having a conversation with you and an enriching experience, sir. Thank you, sir.
Thank you, Rohan. It was a pleasure talking to you and sharing my views with you and with anyone who would be listening to this in the future. Thank you very much. Thank you. God
To
bless you.
conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. If you have a healthcare innovation journey of your own to be a part of our podcast, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host Rohan Tandale from InnoHealth Magazine Studio. Thank you.